Riser recliner chairs offer some really beneficial quality of life advantages for community patients. But with many spending more and more time sitting, lying and sleeping in them, the development of pressure ulcers can be a real problem. Not only unpleasant for patients, but in extreme cases possibly resulting in severe harm or even death. However, the vast majority of pressure ulcers are avoidable, with the right products and procedures in place and when healthcare professionals are aware of what to do to prevent them. Pressure area care is one of the most expensive and time-consuming areas of healthcare. It is estimated that somewhere between 1.4 and 2.1 billion pounds is spent each year on preventing and treating pressure ulcers. That's about 4% of the total NHS budget. Each pressure ulcer can add up to £14,000 in additional costs to care. Repose Contur from Uni-medical is an effective answer to preventing pressure ulcers in patients using riser recliner chairs. It can be used on all patients that are at risk of developing pressure ulcers, including those at very high risk. Not only does it help prevent pressure ulcers from developing in the first place, but it can also be used to manage existing grade 1 and 2 ulcers. The product is in effect an overlay cushion that covers the whole seating area of the chair, including the leg and back sections. The Repose Contur is easy to use and maintain. First, remove the Repose Contur from the tube. Refit the two tubes together to form a pump. Connect the valve on the pump to the valve on the Repose Contur. Inflate the Repose until you hear air exhausting from the pump valve. Stop pumping and wait until you can no longer hear air escaping. Cover the valve on the Contur product using the solid end of the valve cap. Slide the inflated Repose Contur into its cover, ensuring that the valve will be facing into the chair, not sticking out. There are zips at both ends to help manoeuvre the Repose inside the cover if necessary. To attach to the chair, first insert fixing straps between the seat and armrest, looping around the back of the chair. Cross-fixing straps as shown, loosely clip the fixing straps into place. When both straps are clipped into place, adjust until secure. Loop the bottom fixing straps around either side of the footrest until in place. If required, Repose can be easily washed with soap and water. First, wash down using detergent. Rinse with fresh water and allow to dry. If necessary, it can be decontaminated with a chlorine-based disinfectant. Then, rinse again in clean water and allow to dry. The cover can be laundered in a washing machine at up to 75 degrees Celsius with both zips open. Allow the Contur to air dry. To deflate the Contur, first insert the open end of the valve cap into the device valve. Air can now escape. Fold in half and roll it up, making sure to start at the end furthest away from the valve. Air will be released as you roll up the product. Insert the device into the pump and refit the two tubes together and rotate until the two tubes click closed. Once you've finished with the product, it should be returned to the equipment store, where it will be cleaned, disinfected and stored, ready for the next patient who needs it. Repose products have a wealth of clinical evidence demonstrating their efficacy and have been used successfully by the NHS for over 15 years on almost 2 million patients. It's silent and unobtrusive, lightweight and easy to carry, durable and effective, perfect for acute and community settings. For pressure care, rely on Repose.